Welcome to the first monthly episode of the Chronic Illness Catch-Up, where I, Alana Jacqueline, tell you how much time and money I spent trying to survive with a chronic illness. I had 3 main challenges this month, including status migrainosus, hypovolemia, and brain fog induced by insomnia. The status migrainosus, also known as just like an ongoing migraine, has been going on since February. It is not responding to any medication. I've been hospitalized for it twice, and it's kind of ruining my life. The hypovolemia is nothing new. It's also known as POTS or dehydration, something I've been dealing with for over 10 years. And the only problem that I'm having this month is that my veins have been really, really tricky. And so I kind of look like a junkie. There it is. There it is. And the final thing is brain fog induced by insomnia, which is also the reason there are so many cuts in this video. But basically, I fell asleep during a meeting earlier this month. Super embarrassing. It was over Zoom, but my manager was really nice about it. The math isn't mathing. I'm just not accessing the logical portions of my brain right now, so I'm asking that nobody try to attempt to have a logical conversation with me. And please, if you're going to, don't do it over the phone, because I really need captions to fully capture what it is you're saying. Now, in this portion of our presentation, I will try to answer the question, do we all have the same amount of hours in the day? And as you can see here, as far as medications, I was trying to get Belsomra, Zepbound, and Memantine. Now, I spent about 1.5 hours each day on the phone trying to figure that out, and I spent about 4 days a week doing that. That was a total of 18 hours in all. Now let's talk about how much time I spent with infusions and doctors. Now I had 8 fluid infusions, 4 subcutaneous infusions, and 10 appointments with doctors. That is 12 hours in infusions, 8 hours in subcutaneous infusions, 10 hours at the doctor's office for a total of 30 hours a month. And finally, let's talk about the amount of hours lost from symptoms alone. Those symptoms are generally brain fog, pain, migraine, and insomnia. Now, I would say I lost about 8 days total just in having completely symptom overloaded days where I could get nothing done. So just 8 days out of our month just gone already. And then I would say I spent about 3 hours a day dealing with those symptoms, even if it's a good day. Now let's talk about each of these medications that I was trying to get individually. So Zepbound was the first one, and that one had a lot of problems. The first problem is that the doctor who prescribed it, her office is like in the Jurassic age. They don't have my chart, which meant that I spent hours and hours more than I would normally have to try and get this through. The other issue was that medications, all these medications that are weight loss medications, are on back order. So I spent many, many hours just calling and checking with the pharmacist, hey, do we have it in yet? Do we have it in yet? Do we have it in yet? And finally, the money, trying to figure out how to pay for this because it is a full-ass car payment, which we will get into in just a minute. Next, we have the Memantine, and this one I was actually really looking forward to. It's a really cool concept. It's an Alzheimer's drug, and they were using it for predome and postdome and migraines to help with memory loss and things like that. Cool concept, but unfortunately it did not work for me, and it actually made things a lot worse for me and caused me to have heart palpitations and hypertension to the point where I was taking like fistfuls of beta blockers trying to get back to my normal. This one we unfortunately had to discontinue. Now, this next medication is Belsomra. I was actually really looking forward to this one as well. It's a sleep medication, and it actually worked great. Put me to sleep for 9 hours the first night. I did have some weird dreams, though, including a dream where I was like working my full workday, but I was asleep. But at least it was asleep, you know? And then the other thing about it was that it has this blister pack, and one day I tried to like pop out the medication, and the medication like flew somewhere in my room and landed on the floor, and I have 2 puppies. So I spent like an hour with my husband on the floor trying to find this pill. We did find it. Now let's go into the cost breakdown of what we spent this month. Now, keep in mind, I'm not going to go into like the full details of what it costs to live with a chronic illness or disability. I'm not going to talk about like all the changes in my diet or like the kind of place that I have to live and the rent that it costs. Let's just talk about the medications and other like clearly just chronic illness stuff. So the first thing you have is the Zepbound. The Zepbound, of course, was $365. That is with insurance coverage and with the manufacturer coupon. That was the cheapest I could get it, which is the cheapest that I've heard can be gotten. Then the next thing was Belsomra. Again, this was another situation where the insurance did cover it, and I had to use a manufacturer coupon. And that one was $85, which is like not bad, but not great. The Memantine was a generic drug, so that was only $7. And then the rest of my monthly drugs were $300, which is pretty normal. The cost will go down after this month when I've met my complete like copay deductible for medications. And then lastly, I paid $300 towards my specialty neurologist. They are in New York. I use a program called NeuroHealth. I pay $30 a month, and then I pay $100-something per session. So that's worth it to me, and that's how much I spent. Now let's talk about some of the other costs here in just living with chronic illness. Now I told you that I had 8 days where I was like absolutely just done, couldn't do anything. Unfortunately, I did have doctor's appointments on those days, and I could not drive, so I took an Uber. The Uber was $80, it's $20 there, $20 back, 2 appointments. And then I also did a $45 for my Cephally, which is like a migraine device that I use. You have to get new pads, like electrode pads for them. So I paid $45 for that. I also was targeted for an ad on Instagram for GLP drinks that are like specifically made for people going on GLP medications. So I bought that. It was $59 and I don't really like it. And then finally, I had medical debt that I'm paying off. So I paid $250 towards that this month. This brings us to the conclusion of our presentation, which is how much money did I spend? I spent $1,491 on costs for my chronic illness, and I also lost a total of 14 days out of my month just to chronic illness. Let me know if you guys have any other ideas for what I should be tracking for next month's chronic illness catch-up. You can find this report and other resources for patients on my website, AlanaJacqueline.com.